Your evaluation appointment today will take approximately 5 to 6 hours. You have already had your labs drawn and your chest X-ray. Following this video, you will go to the clinic where you will have an EKG, have your picture taken, and you will meet with members of the transplant team. It is important to understand that no patient is ever listed for transplant on the day of their evaluation appointment. There are several more steps to the process before anyone could be listed. The evaluation process is an opportunity for the transplant team to assess whether transplantation may be beneficial to you and an opportunity for you to assess whether transplantation is right for you. You will meet with the following members of the transplant team during your evaluation today. The transplant nephrologist specializes in kidney disease and will focus on assessing your overall health in preparation for a transplant. The transplant surgeon specializes in performing kidney and pancreas transplants and will determine whether the operation can be performed safely on you. The social worker specializes in helping patients and their families understand and cope with the issues they may face related to transplantation. Your transplant coordinator facilitates your journey through the transplant process. You will also have access to a financial coordinator who will assist you in understanding and facilitating the financial aspects of transplantation and your insurance coverage. After all the testing results are obtained, your case will be reviewed by the Transplant Evaluation Committee. The committee includes the nephrologists, the surgeons, the social workers, the financial coordinators, dietitians, pharmacists, living donor advocate, and the transplant coordinators. All listing decisions are made by this committee, which meets each week. The committee will review your case and make one of the following decisions: continue the evaluation process, do not list, or list for transplant. Following the Transplant Evaluation Committee meeting, your transplant coordinator will write a letter to advise you of the committee's decision and notify you of the next steps to take. You should receive this letter within 2 weeks following the meeting. If you do not receive the letter, please contact your transplant coordinator. You may receive a letter advising you the team requires additional testing before they can make a recommendation on whether you meet the listing qualifications. In addition to the letter, your transplant coordinator may contact you by phone to explain the results and the additional testing you need and answer any questions you may have. The letter will include the specific testing you will need to complete before the committee can review your case again. The letter will also include the contact information where you should have the testing results faxed. You may also be contacted by your social worker regarding social goals to complete prior to being listed. Once the results from the additional testing are received, your case will be reviewed again by the committee. Another letter will be sent to you following the review of your case, notifying you of the final decision and any steps that should be taken. You may receive a letter that indicates your records were reviewed by the committee and our team feels that a kidney and/or pancreas transplant is not in your best interest and does not recommend you proceed with transplantation. While this may be disappointing to learn, it is important to remember the committee only advises transplantation when it appears it will benefit and not harm the patient. You may receive a letter indicating that you meet all the listing qualifications and are being listed for a deceased donor organ transplant. The letter will include all the information you need to remain in an active status on the wait list. It will be very important to keep your transplant coordinator informed about any changes in your life that may impact your listing and/or transplant. These may include changes in your address, phone numbers, insurance, health conditions, hospital admissions, surgeries, accidents, and/or blood transfusions.